Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and today we're going to be talking about ankle problems. So two different things that can usually be causing problems in the ankle. One is going to be joint mobility. So if there's something that's dysfunctional in the way the joint's moving, that can create pain, especially if we're not getting the flexion and extension in the ankle when you walk. That can really start to cause some problems, not only in the ankle, but it can change your gait, which can cause problems in the knee, the hip, and into the low back. The second thing that we're going to be talking about is an ankle sprain, which is where you sprain the ligaments on either side of the ankle. So first things first, we'll talk about the function of the ankle. Most of the motion in the ankle is going to be flexion extension. There is some lateral bending, but most of it is going to be here. Just the reason why you don't want as much lateral bending is because it's going to be easy to sprain those ligaments if you move that too much. So when we're looking at the ankle itself, what happens is the bones of the leg come into the foot, and there's a bone called the talus, which then attaches to basically the leg bones to the foot bones. So what we want to do is we want to make sure that especially the extension of the foot is there, and if there is any kind of dysfunction, that we're able to adjust the bones pretty easily. Okay. We also want to be checking the arch to make sure that there's good support there, because that can create some problems with how the foot is sitting in the ankle joint itself. So the adjustment is really the biggest thing that we can do for any kind of dysfunction with the motion of the joint. When you sprain an ankle, the adjustment isn't going to do as much, because the problem is going to be coming more from inflammation and problems with the ligament itself. So each side of the ankle has ligaments that hold the joints in place. The one on the medial side, the inside of the ankle, is going to be a lot stronger, and that's why when people roll their ankles, they almost always roll them to the outside, and they sprain this outside of the ankle, because the ligaments that we're dealing with over here are a whole lot smaller and less stable. So what we're going to do is we're going to go into the PT bay, and we're going to talk a little bit about deep tissue laser, and then also our compression boots. That'll be our ways of helping in the office. What you can be doing at home if you do sprain your ankle is, most people have heard of RICE, which is rest, ice, compression, and elevation. So you want to stay off of it. You want to try to rest it as much as you can. You want to ice it. That's usually 10 minutes on, 10 minutes off. And you want to put a damp rag in between the ice and the skin. That allows the cold to penetrate more. And then compression is going to keep that inflammation out. And elevation, you just need to make sure that that the ankle is above where your heart is, so that the blood can keep flowing back and forth. So we're going to go into the PT bay, and we'll check out the deep tissue laser and the compression boots. So for sprained ankles, we talked about RICE, which is rest, ice, compression, and elevation. Now we're going to be talking about what we can actually do in the office to help speed up that healing process. So our deep tissue laser is probably our best tool that we have to use. And the way this works is this actually uses light to get down to the cellular level, and that's going to cause healing at a deeper level and at a more powerful level than, say, something like ultrasound. So ultrasound works by heating up tissue. This actually works by stimulating the cell itself to start the healing process. So the way we're going to do this is we would go to the area that's sprained. Normally when an ankle gets sprained, it swells into the foot and up into the leg, but normally it's right here on the ankle joint itself, because that's where the ligaments attach to the foot. So what we're going to be doing is we're just going to be running our laser in a square all around the ankle. You don't feel much. There could be a little bit of a warming sensation, but we keep it moving so that it doesn't cause any heat buildup. And we do this for an ankle. We do this for about 3 to 5 minutes, and that's going to create a lot more healing than just the rest, ice, compression, and elevation alone. So next we're going to be looking at the compression boots, and that's going to help move the inflammation and move that blood out of the area. So So the last thing that we're able to do here in the office to help with sprained ankles is going to be our Normatec compression boots. So these are going to really help with that compression portion of the RICE formula that I talked about earlier. And how that's going to work is the pockets in the boots themselves fill up with air, which creates compression, and it goes all the way up the leg and then back down and then back up. And this takes about 30 minutes to go through. You can do 15 minutes, but we suggest it to be about 30. You get to sit back in our nice zero gravity massage chair and get a nice massage while you're sitting with the boots. And we bring the foot piece up to make sure that we're getting that elevation so that we're getting good circulation. So these boots were actually created for people with lymphedema. So if you've had to have any kind of lymph nodes taken out and your body's not able to circulate lymph fluids or blood properly, then that's what these were created for, to kind of mimic the circulation. So for any kind of inflammation problem, especially something like a sprained ankle, these are great to kind of get that blood moving and try to break up that inflammation process.
The extension of the spine will help bring oxygen. Hi, this is Nancy Thompson, this functional fitness specialist at the Springfield Wellness Center. Thinking maybe you've played Weekend Warrior this past weekend and came home with this twisted ankle. Well, if your ankle's been immobilized from injury, there's some things you can do pretty quickly once some pain subsides to help mobilize the joint, get it strengthened and stretched to return you to the activities you love. The first thing you'll want to do is start mobilizing the joint. The joint can become very stiff and immobile after being immobile from the injury, and you'll want to start moving it as soon as the pain subsides. So the first thing you'll want to do is some flexion, and you can do the seated, or even if you're elevated, your ankle's elevated in a chair, but just flexion and extension of the ankle to get mobilization occurring, which is going to help speed recovery by getting the fluids moving in your joint. And you'll want to do this about 20 times, certainly on the injured ankle, but even do it on the good side to stay balanced. So flexion extension movement is very important. You can start the lateral motion of your ankle as soon as the pain subsides. You'll want to hold off on that until, because that's where your injury typically would occur at. But once the pain subsides enough, then you'll want to start inversion and eversion movements at the ankle, but definitely wait till the pain subsides. So mobility is the first thing you want to start working on. The second thing you can do once pain subsides enough to do some strengthening is to do some foot strengthening exercises. So again, seated in a chair on a hard surface, you could do some towel scrunches to help strengthen the foot, which is ultimately going to help stabilize the ankle. And you can pull on the towel with your toes until you've reached the end of the towel, and then do that again, and make sure you do that about 3 times. Again, might as well do it on both sides, both the bad foot and the good foot. And then the third thing you want to do is stretch the area. And again, as soon as you're able to bear weight and the pain has subsided enough, you can get on your feet and either use the back of a chair or a wall and do a calf stretch and a soleus stretch. Working on the rear foot, we'll want to extend the leg, press the heel into the floor, and as you move forward, you'll be doing a gastrocnemius stretch. And then to add a soleus stretch, we would bend the knee, the deeper muscle in the lower leg, and stretch that as well, holding that for about 30 seconds. And go ahead and do that on each side to improve the flexibility on both ankles. So if you can improve the mobility of your ankle, work on that after the injury, help stabilize the ankle by improving this strength in your foot, and then do some stretching to help stretch the other side of the damaged joint, you can really help improve your recovery and get back to those activities you enjoy. This is Nancy Thompson, your functional fitness specialist at the Springfield Wellness Center, wishing you peace and wellness.
So whether you're having a joint problem or a sprained ankle, definitely make sure that you're getting it checked out. to make sure that there's nothing more serious going on, and also to try to help speed up that process. Most people think that they just need to wait to ride out a sprained ankle or any kind of ankle pain, and really if you come into our office, we're able to speed that process up quite a bit. So if you have any problems, or if you know someone that does, make sure you like the video or share it with someone that could find this informative. And if you have any questions, give us a call at 726-0422 or check us out online at wellnessspringfield.com. Thanks a lot.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.